the market is touching all-time high levels. Hospital space is down for second day on the trot. Take a look at Max Healthcare, Medanta, Apollo Hospitals and a lot of the names. They are seeing massive dropping, and that is because of the entire news flow around how Supreme Court might regulate and work towards standardization of prices of some of the procedures. Is that really a possibility? And if yes, what could be the implication? These are the questions that we'll pose to Bino of Elara Capital, who's the analyst joining us from there, and Dr. Ravikumar, he's the chairman of the IME Hospital Board of India. Mr. Ravi, I wanted to begin by asking you first. Okay, Ravi is still joining us, but in the meantime, Bino, I wanted to begin the discussion with you. A, what's the possibility of this happening? Secondly, what could be the implication? Even broadly help us understand what could be the EPS impacts on some of these listed hospital players then.
Sure, hi. So, Supreme Court has told the government to put in place some sort of regulation, but it has not really told the government to implement the CGHS rates across hospitals. So, while some form of regulation will likely come in, may not be in the very near term, but in some time, in a few months or maybe a year, I do expect some sort of regulation to come in place regarding hospital charges, procedure rates, etc. As of now, I don't think there will be any draconian step on the part of the government which will significantly disrupt the private healthcare delivery sector in India. So as of now, the risk of a major EPS downgrade for the stocks looks pretty minimal to me.
Right. So yesterday, Bino, we were speaking with a lot of hospitals all through the day. In fact, Yatharth hospitals went on to say that there will be massive impact on profitability. Some of our colleagues at the print have also spoken to big hospitals across the country. They are saying if implemented fully, then it could mean catastrophic. I am assuming that the government will be very cognizant of the entire ecosystem of the hospital space as well. Have you done any early sensitivity analysis of how much can be, how much impact can be absorbed, how much needs to be passed on? If it is passed on, then could demand be impacted, or what exactly will happen?
So when you say fully implement, I don't think there is anything out there right now to be fully implemented. From what I understand, the Supreme Court has said that unless the government comes up with a proper regulation, it will probably enforce the CGHS rates. But it has not said that it will implement the CGHS rates. So I would assume that the government would come up with something which we don't know as of now what the shape and form and size of that would be. But I believe that the government would come up with something which is not so bad to the extent that it kills private healthcare delivery in India. In case, which is a distant possibility in my mind as of now, they come up with something which is like a CGHS rates or somewhere around that to be enforced across hospitals, irrespective of quality of care, irrespective of the facilities provided, irrespective of the equipments used, highly trained doctors used, etc. If such a draconian draconian step, as in a very low price, is enforced on hospitals, then the impact can be pretty severe, which as of now, I see a very small possibility of that happening.
Fair. So, a very small possibility of that big an impact, but help it break it down for us, at least the initial assessment, whatever you have done. Which are the hospitals that will get the most impacted? Street clearly believes that Max Healthcare is clearly going to be impacted the most. Last couple of days, it's down 15%. And what are you recommending your clients right now? Buy the dips or stay away till this overhang is cleared up?
So I don't really look at this as an overhang because, like I said, as of now, I don't see this as a very big risk waiting to happen. So this is not a reason to not buy hospitals. And if such a draconian step comes through, which itself is a pretty low probability, but if it comes through, I think all hospitals will be more or less equally impacted, not just one or two. Because most hospitals have between 5 and 20% of the patients coming through the government schemes which are low priced, and the remaining 80% or 70% are paying patients who pay through insurance or directly, which are at high rates. It may vary a little bit, 5 and 10% here or there among hospitals, but the impact could be pretty severe and more or less equal across hospitals. And I wouldn't call out one or two that would be more impacted.
Okay, Binu, yes, you're right. We don't know the exact steps that should be announced to bring parity. But let's pose the discussion or take the discussion forward with Dr. Ravikumar, the chairperson of Indian Medical Association Hospital Board of India. Dr. Ravikumar, good afternoon. Thank you so much for your time. In the listed universe, the hospital stocks are a worried lot. But, the discussion around this medical procedures and their costs and how much are private hospitals, charging for them, how much are the public hospitals, it's beyond the market only. I want to understand, where does the reality lie? Now we are picking up that 80,000 hospitals are likely to submit their data to the government, and then only government will look into the data whether there is a case to rationalize the cost structure or not. Then of course the question of how much impact on the hospitals will arrive upon later. But Dr. Ravikumar, you are at the helm of things. Where do the situation lie right now? How much is the differentiation between private hospitals and public ones on key procedures?
So basically, I just wanted to put forward two things. The hospitals' costing as such has not been standardized, and it has not been done either in the public sector or in the private sector properly, scientifically. Okay, the methodology or the practical thing which is going on is nearly 60 to 70% of the hospitals are the small and medium hospitals which are giving the healthcare to the public, and they don't do the costing at all. They overwork for nearly about 18 to 20 hours, and then they're just like that manage it. That is the practical ground reality. So whether they are making profit or whether they are losing, there is no such thing at all. So scientific costing has to be done. It should not be an average being taken from the market and averaging it. That is not a scientific costing at all. Now that standard scientific costing methodology has been given by the Clinical Establishment Act itself, what are all the components to be taken up for a costing which has been given by the Clinical Establishment Act of 2010 and amended in 2012. Based on that, Indian Medical Association, we ourselves have developed a costing template, methodology of the costing template. We have done it. So if we can follow that template and fill up the values as per the hospital's standards,
Sure.
Because hospital standards vary. It is not the same type of hospital across the country.
No, sure,
Each
Mr. Ravikumar, I understand that. But what we're trying to understand is what are the next steps? What kind of representations are you likely to make? What is the solution that you're thinking right now? Because if implemented in this manner, it will be quite detrimental.
So now that the Supreme Court has given a mandate that the government should come out with this, so what we wish is we want the Supreme Court to involve all the stakeholders before they come out with an order. Point number one. Point number two is already we have given and represented our costing template with the government umpty number of times, right from 2018 itself to the government, that the government Directorate of Health Research, they ordered a committee for scientific costing, which did not take up at all. And they have not gone through or given any reply to our scientific costing template, which we have given. What we wish is a committee has to be formed and the proper costing template has to be developed. And based on that template, let them work out the costing.
Okay.
That will give the cost for each and every hospital. Let it be what type of hospital it may be.
Okay,
the template
fair.
contains everything. Okay? There are two components in the template. One is the fixed component and another one is the variable component.
No, sure,
fixed
Mr. Ravikumar,
component.
that helps us understand that clearly. Okay, there are two components to it and you're working and pushing for that committee to actually come back to you. That point
Yes.
is taken, but within your own understanding, what do you think could be the timeline of this? Do you see this happening and working around in 6 weeks itself as has been regulated, or it's going to be a lot more long drawn?
It can be done if everybody sit together. It can be done within a month's time. It's not a very big thing because it is only the template has to be validated and freezed, and you just fill up the components in the template according to the hospitals. The hospitals, it's a varied type of hospitals you have. And
Enough,
the
sir.
various components. See, for example, if you take any equipment, the ventilator, it ranges from near 1 lakh to 30 lakhs, 40 lakhs ventilators are there.
Right.
So you just feed in the components, you will get the result out. So that sort of template has to be formed instead of typing the hospitals and freezing the rates.
Sure.
That should not be the thing.
Sure, so there should be a scientific way to do it. You put in those
Yeah.
component details and that's how you arrive at a value. You can't do a blanket statement. We understand that. Thanks so much, Mr. Ravikumar, as well as Bino, for making time and speaking with us. Would have loved to chat more, but there's paucity of time.